Red Springs.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The WIDU Radio Network, WAGR in Lumberton, WYDU in Red Springs, and WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Welcome to another edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. Today, we are going to focus on two important health issues. We're going to talk about stroke awareness and mental health, because May is both Stroke Awareness Month and Mental Health Awareness Month. And today in the studio, we have Ann Gladstone. She is from Cape Fear Valley's Emergency Department. And we are going to discuss the growing number of mental health emergencies that we see here in the county, the importance of early intervention, and how the hospital is supporting patients in crisis. We also have in the studio someone that you all have seen before, Ms. Megan Dornan. She is stroke coordinator at Cape Fear Valley Health. And we're also going to have Dr. Batchelor with us today, who is the stroke medical director for Cape Fear Valley. We are going to share some important tips on how you can recognize stroke symptoms, the importance of acting quickly, and how you can lower your risk. Now, because of the discussions and the topics that we're talking about today, what we need for you to do is make sure you remember that this is for broadcast purposes only. This is for informational purposes only. This is not going to be a time for you to self-diagnose, folks. So what I want you to do, if you hear anything that may sound familiar, something you may be going through, something a family member may be going through, please find yourself a healthcare professional, all right? Do that for me. Now, ladies and gentlemen, first guest I want you to help me welcome to the broadcast is Ann Gladstone. And as I said, Ann is with Cape Fear Valley's Emergency Department. First, Ann, welcome to the broadcast, and thank you for taking time out of your schedule to be with us today.
Absolutely. Thank you for having me. I'm honored to be here.
First, tell us a little bit about yourself, your role at Cape Fear Valley, what you do for the patients in the community at the Emergency Department.
Sure, thanks. So as you mentioned, my name is Ann Gladstone. I'm a licensed clinical social worker, or LCSW for short, and I serve as the clinical coordinator for inpatient behavioral health services at Cape Fear Valley, which is a long way of saying that I supervise the psychotherapists on our adult and adolescent inpatient units, and then I serve as the primary psychotherapist in our emergency department, where I work specifically with our psychiatric team. So I work in a multidisciplinary team with our attending psychiatrists, resident psychiatrists, psych nurses, mental health techs to assist in evaluating the patient, determining what's going on in this patient's life that we can affect change in, and then determining the best path forward to try to stabilize any crisis that's going on and get people the most comprehensive and most kind of effective treatment that we can.
May is Mental Health Awareness Month. Why is this campaign so important?
Sure. So Mental Health Awareness Month is tremendously important to our patients, our families, our communities, our hospital system, and really our society at large. So Mental Health Awareness Month was a national campaign started by the Mental Health Alliance in 1949. So it's been around for a really long time. And I think that we really can credit a lot of reduced stigma and increased mental health interventions and evidence and research towards the Mental Health Awareness Month. I think it's important to note that in America, roughly 1 in 5 individuals will suffer from a diagnosable mental health condition. Wow. Right. And in North Carolina, we're actually above that average. So in North Carolina, 1 in 4 North Carolinians will suffer from a diagnosable mental health condition. So this is a pervasive a group of symptoms that people in our community are experiencing and suffering with. And so I think all of us probably know someone who's experienced some form of mental illness. Mental Health Awareness Month helps us reduce stigma about people with mental health concerns, but it also helps us advocate for increased research, increased funding, increased evidence-based practice. It helps us kind of widen the net, if you will, of resources and providers in our community who can help serve people experiencing mental health conditions. So it's extremely important for our community. And I think it's also an opportunity to help celebrate those who have experienced mental health concerns and who have been brave enough to speak up and speak out and get help.
Ladies and gentlemen, in the studio and Gladstone, we are discussing mental health and mental health awareness because May is Mental Health Awareness Month. And Ann is with Cape Fear Valley's emergency department, and we are getting ready to ask her now, Ann, the most common mental or behavioral health concerns that you see personally at the health department.
Sure. So
the emergency department. I'm sorry.
It's okay. In the emergency department, I would be remiss to not mention that we see a little bit of everything. And so I don't want to overgeneralize, but I do think that if we really closely tracked the symptoms or kind of crises that we encounter, most of them will fall in kind of three different mental health emergency categories. The first category is going to be someone experiencing an acute kind of crisis of depressive symptoms. So this would be someone having thoughts of hurting themselves. They may have a plan, intent, means, or they may have even attempted prior to coming to see us in the emergency department. The next kind of category would be someone in an active manic episode. So when people are experiencing active mania, they're engaging in kind of heightened risky behaviors. They have a heightened threshold of impulsivity. And so sometimes people can do things or make decisions they wouldn't normally do that can put them in unsafe situations. So that's the second kind of primary psychiatric concern that we see. And the third would be somebody experiencing an active episode of psychosis. And when we refer to psychosis, we really refer to people who are experiencing symptoms of a distorted perception of reality. So thinking is disturbed, decision-making is disturbed. There's often heightened or increased confusion or disorientation. So that would be our third most common psychiatric emergency.
What are some of the signs that someone might be experiencing a mental health emergency? How would we know that? And how would we know to take them to the emergency department?
Sure. Yeah. So I think the first thing, if someone that you know or that you encounter is making thoughts of hurting themselves or hurting others, certainly that would be evidence of a psychiatric emergency that needs to be evaluated in the emergency department. So that's kind of the most paramount sign or symptom that we see. That can sometimes manifest in what we refer to as like mood lability. So someone who's having pretty rapid cycling of emotions or mood symptoms, that could be something that would be kind of a warning sign, if you will, that someone's experiencing crisis. If somebody is engaging in really abnormally risky or dangerous behaviors, that too would be something that would warrant a psychiatric emergency department visit.
Okay. Ladies and gentlemen, in the studio, Ann Gladstone with Cape Fear Valley Health's emergency department. We're discussing mental health issues. We're discussing mental health awareness, and because May is Mental Health Awareness Month. Now, if you want to join in on this conversation, there's two ways you can do this. First of all, you can give us a call at the studio at 910-483-6111. Again, that's 910-483-6111. Or if you're following us by way of our live stream on Facebook, you can leave the question in the comment section, and we'll make sure we get that question answered for you while we have these experts here with you today. Third, I want you to make sure that you share the broadcast. Why? Because we're discussing a lot of valuable information, and this information, chances are, you're not going to remember. So the easiest way to do is share the broadcast. That way people can get firsthand information from what we discussed today. And like I said, ladies and gentlemen, in the studio, Miss Ann Gladstone with Cape Fear Valley Health's emergency department. And speaking of the emergency department, how many patients come into the ED each month with mental health related issues?
Sure. So it's really difficult to give a firm number, but I would guess that on average we see somewhere between 15 and 20 patients for a psychiatric consultation in the emergency department. So if we do that math, 15 patients a day, 30 days, that would render us around 450 consultations for a psychiatric evaluation in the emergency department. Sometimes it can be less and sometimes it can be much larger. So generally speaking, I would guesstimate between 450 and 500 psychiatric evaluations a month.
Wow. And we know that mental health crisis can escalate quickly. I've witnessed one myself. Let's talk a little about what to look for. Because in my situation, everything came all at once and it caught everyone off guard. What are some of the warning signs that someone might be heading toward a mental health crisis, even if they're not saying anything out loud?
Yeah, definitely. So there are some kind of classic warning signs. The first one that we often think about, or that we'll ask family and loved ones of patients that we see, is, has this person been isolating? Have they been spending more time each day kind of alone, not really engaging in normal social interactions that they would normally? Have they kind of cut off from trusted loved ones? That can be a red flag for any of those three emergencies I mentioned earlier. The next would be if somebody is making kind of vague statements about not wishing to be here, or having a lack of hopefulness, feeling increasingly hopeless that things could improve in their life. Another warning sign could be a decreased need for sleep or decreased sleep over multiple days. Sleep is like a vitamin for the brain, so when we go a long time without it, our thinking can become quite distorted. Another warning sign would be when someone has difficulty getting their thoughts out, or it feels like their thoughts are quite jumbled, and sometimes that can become kind of progressively worse. The last warning sign that I think is really helpful for people, especially people who've never encountered psychosis before, is when someone's making kind of odd statements that don't seem to really track with the conversation at hand, or maybe speaking to unseen others. All of those would be kind of our classic warning signs that we would be asking people about when they came to the emergency department.
In your experience, how do symptoms of mental health issues sometimes appear physically or behaviorally in a person?
Sure. So for physically, we often see changes in appetite, changes in sleep. Some people will have physical complaints that are actually manifestation of mental health symptoms. So that could be gastrointestinal issues for people struggling with anxiety or depression. Sometimes we'll see people complain about muscle aches or headaches as well. So those are some of the physical manifestations. Some of the behavioral manifestations will include changes in how people interact socially, changes in how people conduct their normal routines. So for someone who, say, works a full-time job, maybe they're missing work more regularly, or they're not completing their daily tasks as they normally would. Changes in hygiene can both be kind of behavioral or even physical symptoms as well. And then we'll also notice, again, altered mental status or increased confusion, disorientation is a behavioral symptom. And when that comes on pretty suddenly, that might warrant a psychiatric evaluation as well.
The differences in the mental health between men and women, what are the differences?
There are quite a few. One of the first ones that kind of pops into my head is differences in how men and women can behave in a depressive episode. So for women, we'll often see more depressive symptoms present as increased feelings of sadness, increased feelings of guilt, shame, worthlessness. They're more kind of internal symptoms. For men, we'll see depression sometimes manifest as increased irritability or an increased quickness to anger. So it's a more external presentation of symptoms. The other thing that we notice a lot between men and women is the age of onset. So for example, our primary thought disorders, psychotic disorders like schizophrenia, the symptoms for men are going to present between ages 18 and 25, and for women, they're going to occur later, between ages 25 and 35.
Okay. What about adolescents or older adults?
So with adolescents, because age of onset for some disorders is going to be later into early adulthood, we may not see as many psychotic disorders, for example, in adolescents. And the other thing with adolescents is we'll see a lot of symptoms that look like anxiety or depression or mood disorders, but are actually untreated symptoms of ADHD or attention deficit hyperactivity disorder. In adolescents too, a lot of times we'll see a difference in how people come to treatment. So with adolescents, they're being kind of asked to come to treatment by family or supportive loved ones. With adults, we have a little bit more buy-in typically initially with treatment.
Okay. Ladies and gentlemen, our guest right in the studio, Miss Ann Gladstone. We're discussing mental health today because May is Mental Health Awareness Month. And she experiences it firsthand because she works for Cape Fear Valley Health Department. And she is our in-studio guest today, one of our in-studio guests today. And when we see a loved one struggling, it can be very difficult to know what to say, to know what to do. What can family members or friends do if they think someone is in trouble emotionally or mentally?
Yes, so it can often be our first inclination when someone that we love and treasure is experiencing a struggling event. It can be our inclination sometimes to panic and to jump into fix-it mode. And what I encourage people to do first is to kind of take a beat and really come from a perspective of trying to gain to understand rather than necessarily take action. So the first thing would be to kind of create this open communication dialogue with the individual or loved one who's struggling, allow an opportunity for them to voice what they're experiencing, and really actively listen to understand rather than listen to respond. And then when appropriate, we want to validate that person's experiences, emotions, feelings, symptoms. We certainly don't want to nullify their experience. And then when the time feels right, we want to encourage people to get help if needed. And help can look like many different things. There's a lot of different resources. So we really want to gain clarity on what's going on, how it's impacting our individual loved one, and then what the best course of action is from there with their buy-in and their contribution.
All right. And before we go into our first break, Ann, if someone believes a person is in immediate danger to themselves or to others, what is the best course of action for us to take?
When you believe that someone is in imminent danger of hurting themselves or others due to a psychiatric illness, always call 911. This gets the appropriate authorities to make sure that the scene is safe, to then provide any treatment if treatment is needed there, medical treatment, and then to get that person to the emergency department where we can certainly ensure safety.
And let's talk about the mental health crisis line real quick before we go into break. What happens when a person calls? First of all, is it still 988?
Yes,
okay.
it is.
And what happens when a person calls that number?
Sure. So when someone calls 988, instead of being put through to like a police dispatcher, if you call 911, 988 puts you through to a crisis specifically trained clinician, so an LCSW like myself or an LCMHC, and the point of the 988 is really to kind of intervene when people are having crisis like suicidal thoughts or suicidal plan, but they can also intervene if someone feels exceptionally overwhelmed, and if they didn't get help right then maybe they would become suicidal. And so it's wonderful because it's 24/7, it's always accessible. In the same way that if our phones are dead, we can still contact 911, you can still call 988 as well.
Awesome.
And so it gets you put through to a clinician. Now, if you are in imminent danger, right, and that clinician does think that you might need an immediate evaluation, they will initiate 911 services, but they will evaluate that situation with you first.
All right. And Paul, I know we have to go into break, but I would need to ask this question first. Let's talk about reducing the stigma in the workplace, in schools, and within families. How do we go about doing that? How do we make that conversation happen?
Yeah, so it's really important that we are talking about these warning signs a lot. So in the workplace, if we notice that a coworker is struggling, we need to allow kind of an opportunity of dialogue with that person to find out, is there something more that we could do to support you here? We're really fortunate at Cape Fear Valley that we have EAP, Employee Assistance Program. So we have that built into our employee benefits. If you're needing support or you feel like you're going through a particularly stressful time, that service is always available to you. For schools, Interestingly, as of 2023, 37 of the 50 states had passed legislation to mandate education of mental health symptoms, prevention, and treatment in our public schools, which is so important. And I think that that's really leading to more of our young people seeking help, and therefore we're able to kind of get a hold of these symptoms before they become danger crisis situations.
Let's talk about community resources, online resources. What is out there to help people with their mental health journeys?
Sure. So at Cape Fear Valley, we're here for you. We have, of course, our emergency department for people who are in crisis. We have our adult and adolescent inpatient psychiatric units where we sometimes will admit people from the emergency department for stabilization. We also have a standalone outpatient clinic off Rayford Road on Executive Place where we offer an array of outpatient services, medication management, talk therapy. So we can help you if you need help. There's also dozens and dozens of outpatient clinics here in Fayetteville. The best way to find them is to go on psychologytoday.com. There you can do a very focused search on what provider in your area offers treatment specific for the symptoms that you're experiencing and who accepts your insurance funding, etc. So those are two resources that are out there. The last thing I want to share, especially for North Carolinians, North Carolina went through a major trauma after Hurricane Helene, and we're seeing really rapidly increasing rates of mental health crises in the western part of the state. So in North Carolina, they just initiated our own 24/7, kind of not crisis line, but similar. It's called Help 4, number 4, NC. And if you call that line, you can get confidential emotional support 24/7. And they are also exceptionally trained at finding credentialed therapists and medication management providers local to you. So they can take the searching part off of the person in a mental health issue.
And this is for anyone within the state?
Correct.
Wow.
Yeah, it's really great.
All right. And before we go, there were so many more questions that I wanted to ask you, but what is the main thing that you want our listeners and our viewers to take away from our discussion today?
I want people to take away that there is certainly hope and that treatment can be very effective. 70 to 90% of people with a diagnosed mental health condition who have sought treatment have noted a significant reduction in problematic symptoms. So if you are experiencing any kind of symptom, whether it's severe or whether it's more minor, it's okay to seek help, and help very well could help you. Help doesn't necessarily mean a medication. It could just mean therapy and lifestyle changes, or it could very well mean integration of medication. The point is, treatment is person-focused, it's patient-centered, and there are resources that can help reduce suffering and increase positive functioning.
All right. And will you come back on the broadcast so we can go into the more discussion? Thank you so much. Ladies and gentlemen, we have been speaking with Ann Gladstone. Ann is with Cape Fear Valley Health's Emergency Department. And we have been talking about the growing number of mental health emergencies in the community. We've been talking about intervention and how the hospital itself is supporting patients during the crisis. Next, we're going to bring in Megan Dornan and Dr. Batchelor, and we're going to talk about stroke because in addition to Mental Health Awareness Month, it's also Stroke Awareness Month. Cape Fear Valley Health's Making Rounds Live. Thank you so much for joining us.
We'll be right back with more of Making Rounds Live.
Cape Fear Valley's Making Rounds Live.
Broadcasting and streaming live from the WIDU Community Room on 99.7 FM, 1600 AM.
The WIDU Radio Network.
Hello, I'm Dr. Teresa McAllister, the founder of Rafa Ministries Family Center, and you're listening to Wake Up.
President Donald Trump spoke at the annual Memorial Day ceremony in Arlington National Cemetery on Monday. More than $450 million in Helene relief funding could be held up in the North Carolina General Assembly if senators decide to incorporate it into the budget instead of passing it as a separate bill. The House passed the $464 million Helene relief measure as a standalone bill on Thursday. The U.S. Senate is about to take up a federal spending bill that could cut billions of dollars from health care programs like Medicaid. Families of some fallen veterans honored their loved ones in a unique way in Wilmington. 10 new markers were lowered into the ocean with families holding a service from the nearby boat. Caudle's Electric Building in Kernersville, built in the 1800s, is now considered a total loss. Fire gutted the family-owned business and institution around Kernersville. Mike Rayleigh, NCN News.
I'm Jamie Monticelli, WIDU Radio News. Join Cumberland County for Coffee with the Commissioners and share what matters most to you. You can find a date and location near you and be a part of the conversation. The next event is today at Miller's Brew Coffee Shops Cafe West in Cumberland County Public Library's West